Welcome back. My next guest is Dr. Thomas Slabaugh, who is a urologist with the Lexington Clinic. Welcome.
Thank you.
Now, we talked about uterine cancer in females. We're going to move over and talk about prostate cancer in males.
Sure.
Who's at risk?
Well, prostate cancer is an extremely common cancer. In fact, 1.5 million cases are estimated to be diagnosed this year around the world. So it's a real prevalent disease. People who have family history are at high risk. African American males tend to be at higher risk. So those are the people that we focus on in screening. But we do recommend any men who have urinary symptoms, you need to be screened.
Well, let's talk about that a minute. Screening. What is screening? What do you do? What does that mean? Well,
when we screen someone for prostate cancer, we're going to do an exam of their prostate, and we're also going to do a PSA, which is called the prostate-specific antigen, and it's a screening test for prostate cancer.
When do you start?
Most people start at 50. If you have family history, or if you're African American, we recommend that you start screening at 40.
And you screen everybody, because at some point in time there was some debate, you do or you don't.
There has been debate in the past. Unfortunately, when that debate happened, the next 4 years the screening went down and the incidence of high-risk prostate cancer went up. So we've gone back to screening almost everybody.
Okay. So you also mentioned symptoms. Give me some symptoms of prostate.
So symptoms that are common with prostate problems are things like a diminished urine stream, or frequent urination, or urgent urination. Sometimes people will wake up several times a night just to urinate, and those are symptoms of prostate problems.
Okay, and when you say prostate problems, not everybody who has those symptoms has prostate cancer. They could just have an enlarged prostate?
That's exactly right. However, we do encourage people who have those symptoms to see their doctor so they can be screened for prostate cancer.
Okay, so let's just take a little detour here and say they don't have prostate cancer, but they still have prostate problems.
Sure. What's
some treatment for that?
Well, there's a lot of medicines that we can use to help with prostate problems. There's also surgeries that we can do for benign prostate disease. That's the type of prostate disease that causes these urinary issues.
But there's also treatment specifically for prostate cancer.
That's correct.
Tell me about those options.
Well, when we identify someone who's at high risk for prostate cancer, we typically will do biopsies of the prostate to get tissue to make a diagnosis. Once we have a diagnosis, then we try to stratify that patient's disease individually for each patient, taking into account the aggressive nature of the disease, how far it has spread, if it has spread at all, the age of the patient, and then we tailor the treatment options for that patient.
Okay. Before we get to treatment options, does imaging come along? You mentioned biopsy. Are there any x-rays, ultrasound, anything you do to help you?
Yeah, so a lot of there are a lot of new things in prostate cancer now. So if we have someone who has a suspicious PSA or a suspicious prostate exam, before we jump to a biopsy, we will often now do an MRI of the prostate. MRI gives us a more focused idea of what's going on in the prostate and allows us to target our biopsies rather than doing random biopsies like we have in the past.
Okay, so you've done the imaging, you've done the biopsy, you've got prostate cancer. Treatment options?
Well, treatment options are dependent on the patient's individual disease, but in general, they run the gamut. We can go from active surveillance, which is a way of just monitoring prostate cancer without treatment, or we can do surgery. We also do radiation therapy, and there's some other ablative techniques that are available as well. There's a long list.
Yeah, well, I heard watching the media that there is also targeted focus ultrasounds that they're doing and things of that nature.
Yeah, in fact, I do focal therapy for prostate cancer, and we use a technology called irreversible electroporation. So we use MRIs and we use ultrasounds to focus on the prostate cancer target, and we can treat that individually, which limits side effects from treatments that you might have with a more whole gland approach.
Now, you mentioned side effects. Briefly tell me what some of those that people might want to be aware of.
Yeah, so if we're going to treat prostate cancer, any treatment has the potential for urinary control problems and erectile dysfunction. Those are the main two that men are concerned about.
But they are also treatable.
Very treatable.
All right. Well, we thank you for coming in. We thank you for all you do and appreciate the information.
Absolutely. Thanks, Jeff.
We'll be right back.